name is Salisha Suresh. I am going on, I think, my 15th year in the district, 14th year, something like that, most of which was spent at Oakland International High School or as a teacher and principal. And I have been doing COVID things for the last year and working with a number of fine people on trying to do everything we can to keep our kids safe, to keep our staff safe, and reopen schools. And so I'm going to go over just some high-level information. As Allison said, all of this is online. It is getting updated every day. So feel free to come back and then you can note in purple where there are updates when the county or the state changes their guidance. So if we go into the next slide, just some of the really kind of important high-level items, in particular, things that are different than last spring. So first, of course, a big announcement last week, staff are required to get fully vaccinated or to begin getting tested weekly for COVID. And so we have a couple of weeks now to send your information about your vaccination status to the talent department. And then starting in September, that requirement will go into effect. So just raising that here for anyone who has questions about that. Also, really emphasizing the importance of wearing masks for staff as well as for students, for vaccinated as well as unvaccinated individuals, both indoors and outdoors at all of our sites. Physical distancing is not required. It's not in the guidance from the state of California. I know that this is often one that feels a little bit contentious, but it was very clear that the state said, we've been looking at the data around school return. Physical distancing is not up there in terms of the ways in which we can mitigate the transmission of COVID in our schools. It's about getting vaccinated. It's about getting tested. It is about wearing masks. Daily health screenings are required for staff members. So any staff members, contractors, adults, volunteers who are working on our campuses at any of our sites should be filling out their daily health screener in Parent Square. So we don't need to check in with a human when we are coming on campus, but we do need to make sure that we are putting in that health screener every day we are showing up on site. And that access, that health screening is also available to students, and we're using it for students primarily to track when someone might be positive or in close contact or symptomatic, to look at the timeline for when we need to follow up with the family and provide support. Extracurricular activities are open. Those are allowed right now. We are working closely with the Oakland Athletic League to make sure that we have strict attendance policies and testing protocols in place as well to make sure that we're taking care of our student athletes. And we are also using what's called a modified quarantine protocol when there is a positive case. And I'll talk a little bit more about what that looks like a little bit later on in the presentation. Next slide. So one thing that I'm asking all sites to do is to make sure that they are posting the list of symptoms from the CDC up at their sites so that staff members, students know what the latest list of symptoms are so that they are not coming to school if they are symptomatic. And so this is a super important thing to remember, is that whether you are vaccinated or unvaccinated, if you are having symptoms, you need to stay home. We're also asking that sites make sure they're collecting seating charts so that we can more appropriately support the contact tracing process when there is a positive case. Okay, next slide. Okay, so one thing to remember about the whole COVID response situation, and this is true even going back to last year, is that there is not any one thing that is going to prevent the transmission of COVID. It is really a combination of multiple layers of safety. And so we are doing masking, we are doing vaccinations, we are doing testing, we have improved ventilation, but then there's also all of these things that are contingent upon our own personal ability to keep ourselves safe and to keep our community safe, that we need to stay home when we are feeling symptomatic. We need to stay home when we've been unvaccinated and in close contact with someone. We need to go get tested if we have symptoms, right? And so that we're really trying to send the message that this isn't about, the district doing a thing or the principal doing a thing to keep people safe on campus. This is about each and every one of us taking the steps that we need to, both on site and off site, to keep ourselves safe and to keep our community safe. Next slide. As Allison mentioned, all of the resources that we're looking at today, as well as many, many more, are on the staff COVID portal. And so you can go there to get the updated guidance or to look up this information if it is just a lot to take in today. Next slide. Okay, so as I was saying, one of the most critical things that you or any individual can do every day is to stay home if you are feeling symptomatic. And the way that we are defining being symptomatic is there is a list of symptoms that we'll show you in a second that the CDC has defined, like these are kind of hallmark symptoms of having COVID. However, they are also hallmark symptoms of a lot of other ways of being sick. And so the important thing is to pay attention to see if these are new or different symptoms to this individual, to the student or to yourself. And if they are new or if they are different, then you should stay home. Yes, thank you. So this is the link to Parent Square. And Parent Square, again, is the screener that we are using. I see that there were some questions in the chat that came up of just challenges getting access to Parent Square. I know that has been an ongoing challenge. The help desk, I think, is working their way through the tickets that are coming in to make sure that people have access. So do email helpdesk@ousd.org if you're having trouble getting onto Parent Square so we can get you added. And then this is the list of symptoms as well. So these 12 symptoms that are over on the right, that is available. Those are the most recent updated symptoms, both from the CDC as well as the county. And if that list changes again, we will make sure that we change our list internally as well. Next slide. Okay, we're not going to go over this video now, but there is a video that's embedded in this slide that shows a little bit about how to log in and use the Parent Square screener. Some other just things that are important to pay attention to and to message to our community as well is just remember that, again, if you have new COVID-like symptoms, please stay home. Make sure that everyone is doing their health screener every day. We are not checking for temperature, like we're not taking temperatures at the entrances, and that is as per state guidance as well as county guidance. And one of the main reasons for that, right, is that COVID manifests really weirdly in a lot of different ways, and not always with a fever, right? So just checking for temperatures isn't actually the thing that is going to keep us safe. It is really attending to, do you have any new or different symptoms? And if you do, you should stay home. Please also know that, many of us work in confidential roles where we will learn about positive cases, or you will just find out in conversation that there was a positive case. Please keep that information as confidential as possible. We should not be sharing information about students or staff members who might be positive or who might have symptoms or who might be in close contact. That is, protected health information. And of course, we all have to deal with sensitive information sometimes, but let's try and honor the confidentiality of individuals who are affected, not just for the sake of the privacy of their data, but also to just, reduce the amount of stigma that person might have to face when they are coming back to work or they are coming back to school. It's super intense for a lot of families who are dealing with COVID right now. And the last thing they need to worry about is having their kid come back and not be fully welcomed back into the community after their absence. Next slide. Okay, so here's some more information as well about Parent Square and like how to log in and what to do if you need help. Next slide. So I want to talk a little bit about face coverings. So we've all, I think probably over the last year, found the mask that works for us, and we've found our favorite masks, and I bought a bunch more for my kids the other day so they could go back to school. So a reminder of like the different kinds of masks that are acceptable. We are providing cloth masks and disposable surgical masks at all of our schools for anyone who is not coming to school already with their own mask. And, the masking guidance, again, is not like an OUSD policy. Like this is by the order of the public health department that we wear a mask when we are indoors. And that is in any public place. So that is for schools, but it's also if you go to the grocery store, if you go to a restaurant, any of those places, you should be wearing a mask. And same thing in terms of like the kind of mask. That is also us following CDC and county guidance for school settings, right? So there are different masks that are recommended for different kinds of settings, and cloth masks and surgical masks are the ones that are recommended for use in school settings. We do have the N95 and the KN95 masks available as well that are recommended for unvaccinated individuals who need them. Next slide. So two additional things around masks, right? There are mask exemptions for individuals who have medical needs that prevent them from actually being able to wear a mask successfully. And then we do have a centralized PPE ordering, delivery, inventory system. And we have safety leads that are at each of our sites who do that ordering every 2 weeks to make sure that the site is well stocked with PPE. Next slide. Some people find wearing face shields much more comfortable. That's totally fine. We have lots of face shields that are available for employees as well. But it is important to remember that you have to wear a mask underneath your face shield. Next slide. Okay. And then I'm happy to cover the testing and the vaccine slides as well. Okay, so we have a fairly extensive testing program in OUSD. I think it's probably the largest one that's running in the county at this point, that is open to all staff, all students, and any OUSD family members as well. And so there's a few different things we're doing for testing. One, we have some standing hubs around the city that are just open. You can make a reservation online through the Sign Up Genius link that's here. You can also just walk in and take a test. And we're offering both rapid tests as well as PCR tests. And the reason we're offering both is that, the rapid tests are quite sensitive and of course give you results right away in 15 minutes. But the PCR tests are even more sensitive, and as far as the medical community is concerned, is sort of the gold standard for us being able to test for COVID. And so we also want to do that test so that within the next 2 days, if the rapid test happens to be negative and the PCR is positive, we're still finding out as quickly as we possibly can so that we can initiate quarantines or isolation periods as needed. We're also providing, a couple more things. So we're also providing to school sites some rapid at-home test kits. And there are more of these that are arriving from the state as well, so that if there are families or staff members who want to take those kits home and test themselves at home, they are able to do that. And what we've been doing for the last week into this week as well is sending teams of testers to school sites to provide testing on site. So when there is a positive case that we find out about where there was actually on-site exposure, so that positive individual was at school or at work or wherever during their infectious period, then we identify who the close contacts are. We tell those students, come to school, we will test you at school, so that we are trying to minimize the amount of time where kids are in and out and families are struggling with childcare and school is just back and forth. And so that's the modified quarantine guideline that we're following from the state. So those are the different ways in which we are providing testing right now, and are working with the city and the county to expand more hub locations as well. And then just a reminder for unvaccinated staff, the mandate goes in place in September. That if you are not fully vaccinated at that time, you need to be getting tested weekly. These are where our hubs are. We're trying to have at least one available in kind of every corner of the city. Next slide. And then, finally, vaccines. We've been partnering with the county to get vaccine pop-ups at a number of our sites, and a lot of our secondary sites have already hosted at least one vaccine pop-up so far. And for staff members, right, again, reminding us about the mandate that gets put in place in September. So as of September 7th, if you're not fully vaccinated, you will need to get tested weekly. And if you haven't yet already, please submit proof of your vaccination status. You can take a picture of your card. You can download the proof from the state website, either of those things, and email it to this email address, so that the talent department has that information on file, and so they can classify you as a fully vaccinated staff member, and that you are then not subject to the weekly testing requirement that goes into effect in September. There's some, I think, an embedded video on this slide from one of our doctor partners at UCSF about just vaccines and variants and how effective the vaccines that we've all been taking, all three of the vaccines, actually, Moderna, Pfizer, and Johnson & Johnson, and how effective they've been actually against the variants that we've been seeing. Next slide.